Hello everyone, welcome to this lecture on Introduction to Pharmacokinetics and Pharmacodynamics. So first of all, I would like to recommend that was this lecture on splanchnic circulation so that you can better understand this lecture. What knowledge do we have? We know that pharmacology is the study of substances that interact with living systems through chemical processes, and we know that the drug is a chemical substance of known structure which, when administered to a living organism, it produces a biological effect. So then today we are going to understand the affair between the drug and the body and what happens to the drug in the presence of the body, and what is pharmacokinetics and what is pharmacodynamics. So we know that when the drug interacts with the body, two things will happen. First, drug will activate or inhibit the normal body processes and have some biological and therapeutic effect. And second, something will happen to the drug in the body. Okay, so these are two things that they are going to happen. So the drug will do something to the body and the body will do something to the drug. Now let's discuss what will happen to this drug in the body. Now the most common route through which the drug is administered is oral route. We know that. Why? Because it is most convenient. So suppose you have given the drug by the oral route, the first thing that will happen is absorption of the drug from the gut. So what happens to the drug in the body? So suppose you have given the drug by the oral route, so first thing that will happen is the absorption from the gut, and after absorption, what will happen? This drug passes through the gut and there is absorption, and after absorption what will happen? It will distribute to the whole body, and when it will distribute to the whole body, it will also pass through the liver, which is the main metabolic house in our body, and when it passes through this liver, metabolism happens. Okay, and all those metabolites are excreted out, and the most common route of excretion are our renal route as well as from the liver to the feces. Okay, so all this happens when you give a drug to a body. Okay, so these are four processes of the pharmacokinetics: absorption, distribution, metabolism, and elimination, ADME. These are four principles of pharmacokinetics. So what is pharmacokinetics? It is the study of what happens to the drug in the body. Okay. So now this drug in our gut will reach to the circulatory system, and this drug in the circulatory system will remain as the free drug. Now this free drug, of course you have given this drug to have some therapeutic effect, so this free drug will reach to the therapeutic site of action, and at the therapeutic site of action it will bind to the receptors, and at the receptors it will have some therapeutic effect. With that, it will also reach to some unwanted site of action where you do not want, but still it will reach there because of distribution in the whole body, as well as it will reach to some tissues also, and these tissues will act as reservoirs. Okay, So all this happens when you give a drug into the body, as well as in the blood there are some proteins, and this drug will bind with these proteins also, okay, and will form the drug protein complex, okay, and this drug protein complex and the free drug will remain in equilibrium, okay. So free drug molecules are there, as well as the drug molecules that are binded with the proteins, okay, all this will remain in equilibrium with each other, as well as you can see that the drug which is binded to the receptors will also remain in equilibrium with the free drug that is binded with the tissue will also remain with the free drug, okay, as well as the drug at the unwanted site of action will also remain in equilibrium with the free drug, okay. So after absorption, this drug will distribute as well as metabolize in the body. So suppose this whole body, we will consider this as a central compartment, okay. So after absorption into the body, the drug will distribute as well as metabolize. So all this happens in the central compartment, and after metabolism it will be excreted out from the body, okay. Now let's see this structure. So the drug which you have given, it will liberate into your GI, and after liberation, it will get absorbed into your circulatory system, into the central compartment, and will remain as a free drug. And this free drug will reach to the therapeutic site of action. This free drug will reach to some tissue reservoirs, as well as this free drug will reach to some unwanted sites of action, as well as it will remain with the protein bound, okay. And this free drug will pass through your liver, the main metabolic house, and it will get bio transformed, means metabolized, okay. So this free drug will get metabolized there, and metabolites will form, and these metabolites will be excreted out from the body, as well as some free drug also directly get excreted out from the body, and this is known as clearance, okay. So this whole structure, this whole figure is very important, which we understood it slide by slide. Now the drug at the therapeutic site of action will have some pharmacologic effect, okay, and this pharmacologic effect will lead to some clinical response, and this clinical response will cause some effectiveness of the drug, and this effectiveness will leads to the happy patient, okay, as well as there will some toxic effects too into the body, okay. So all these things, this pharmacologic effect at the therapeutic site of action, this clinical response, effectiveness, and the toxicity, all this which happens due to the drug, all this is known as pharmacodynamics. So whatever is happening with the drug is pharmacokinetics, but whatever the drug does to the body, it is known as pharmacodynamics. So it is a quantitative study of the biological and therapeutic effect of drug. Okay, so this is the pharmacodynamics. Thank you. Do subscribe, like, and share. So then what knowledge we gain today? We know now that the pharmacokinetics is the study of what happens to the drug in the body, and pharmacodynamics, it is a quantitative study of the biological and therapeutic effect of the drug. Now you have an assignment. Please share that during the drug development process, in which phase of the clinical trials? We know that there are 4 phases of clinical trials. So out of these 4, in which phase of clinical trials do we study the pharmacokinetics of a drug? These are the references. Thanks a lot.